Hi, everyone. I'm here again with Dr. Nario. Thanks for being with us, Doc.
I see. Thank you for having me again. Oh, it was a pleasure.
We're going to talk about hyperbaric therapy. So, if you guys have questions, put them in the comment section. If you want to know more about Dr. Nario and the clinic he's at, you can visit them online. It's Biointegrative Health Center in Reno, Nevada, and they do lots of what I think are cool treatments. So, Dr. Nario, tell us what hyperbaric therapy, what is it?
All right. So, Steve, this is something that's been out there. And this is basically, if you want to look at this, people picture this as a giant submarine looking chamber where someone lies inside looking like they're about to launch you to outer space. And honestly, the first time I saw one, I thought we are treating patients or are we preparing astronauts, right? Today, I want to introduce you to the smaller cousin. So this is the soft shell hyperbaric chamber. So it's portable, inflatable. It looks like a little bouncy house for adults. So the only difference is you're not allowed to jump inside. And many wellness clinics now advertise these chambers for anti-aging, recovery, brain health, inflammation, mold illness, athletic performance, and such and so forth. And here's the $1 million question. Do they actually work? So we will discuss that today in relation to what science is behind it and what is not. And is it all just marketing?
Okay, so, boy, you named some really beneficial things there. So, what's the process? You come, you get in this thing,
Right.
and how long do you stay in it? What's the process of this treatment?
Right. So the method how it works and is because imagine your bloodstream as a delivery truck carrying oxygen. Normally most oxygen rides inside the red blood cell. But when pressure increases, more oxygen dissolves directly into the liquid part of your blood called the plasma. That allows oxygen to reach tissues that normally receives very little. Now, soft chambers, because there's a hard chamber that we can discuss later, don't create nearly as much oxygen as the medical ones. So those are the ones in the hospitals. But interestingly enough, pressures itself appears to have biological effects. And research have seen that it improves circulation, inflammation, cellular signaling, and even tissue repair. So think of it this way. A hard chamber is like turning the garden hose on a full blast, and a soft chamber is more like turning the sprinkler on. Less powerful, but still watering the lawn and giving you good effects. And just giving you a good idea what the differentiation of the hard shell and soft shell is. So the first thing to understand here, not all hyperbaric chambers are created equal. Think of them like coffee. A hard shell chamber is espresso, and soft shell chamber is a latte. So hard shells are usually they're in the hospitals, but there are some clinics who carries that as well. Soft shells, these are the ones that you would see in longevity clinics, in anti-aging clinics. Both basically contains coffee. So one's is simply much stronger. Medical hard shells usually operate around 2 to 3 atmospheric pressures while breathing nearly 100% oxygen. And they are FDA approved for serious conditions like carbon monoxide poisoning, radiation injury, diabetic foot ulcers, severe infections like foot infections, like for diabetics, decompression sickness. For the soft shells, the one that we see outside all the time in commercial areas, they operate around 1.3 atmospheric pressures and use regular air. That means they deliver only a modest increase in oxygen. So if everyone tells you they're exactly the same, they're not. The question isn't whether they're identical. The question is whether the smaller dose still has meaningful biological effects, and it does.
So, it sounds like it's kind of like blood doping.
It can be defined as that. And you asked me about the process. So what happens here is you stay in the chamber for at least 60 minutes. It's almost like imagine being submerged below like sea level in a submarine. You will feel that while you're there, you're gonna feel your ears popping, and sometimes you feel the pressure. You're getting pressed on the bed that you're laying in, because that's the simulation that what it's trying to do. Be basically pushing oxygen in your body, forcing it so that the organs that are not getting oxygen will get it, and thus you get the result. And even when you're done with the whole process, they need to decompress the chamber. You can't get out that quick. Your eardrums might pop open. So even the soft shells, you have to observe these things as you do this.
So, you said this is a treatment for people use for anti-aging?
Yeah. So really, when you mentioned about what does the science say? So that's basically a question that the best known studies was done by Dr. Rosignol in 2009. This is something that's really interesting for me because children of autism underwent 40 sessions of mild soft shell hyperbaric chamber using 1.3 atmospherics and 24% oxygen. And what they found improvement in social interaction, receptive language, eye contact, and overall functioning. 80% of the treated children showed measurable improvement versus 38 who did not. So earlier studies actually found reductions in inflammatory markers. So this is where the anti-aging effects are. It lowers CRP without increasing oxidative stress, and also it can be helping concussion recoveries, chronic fatigue, fibromyalgia, athletic recovery, and results are encouraging. Again, preliminary studies are out there, but many studies again are starting to come out because this is something that's very promising in the medical field.
People are really into this anti-aging, feeling better. And the younger generations, the Z generation, surprisingly, they're kind of
Hmm.
into fitness. It's kind of surprising me.
Right.
Um,
Well, the bigger question there is who can benefit from this therapy, right? Especially in the
yeah, who?
integrated field. So again, the ones that I have seen, people who have chronic inflammation. Who doesn't have chronic inflammation? Brain fog, forgetting your keys? Yep, probably brain fog. Mold-related illness, post-concussion symptoms, fatigue, and even athletic recovery. So the one who I've seen this, who does this, LeBron James, he's very vocal about this. He shows him in this chamber, and again, many benefit as part of a very comprehensive program. So remember, hyperbarics don't replace good nutrition. They don't replace exercise, replace sleep. If you're sleeping 4 hours a night while living in donuts, no amount of oxygen is going to negotiate that for you. But again, this is a trend that you would see professional athletes now are doing, and LeBron has his own chamber in his home as he was preaching this to everybody.
So that's interesting. So how much does a chamber cost?
That's a good question. I don't have one. I go to a facility. I think it's around in the 80 to 100,000, 60 to 80,000, depends on the model that you're going to be getting. But definitely,
It's like a decent car.
yeah, it's almost like that. But I'm sure it's going to get cheaper.
You don't have one in your clinic right now?
No, no, we don't have one. I need to refer patients to a specific facility for that because it's yeah,
And
it's a
do
it's,
these clinics that usually have those, I'm assuming they have more than one.
yeah, they're just chambers. I mean, as you go in
Okay.
there,
That's
they
quite the
just go in.
endeavor. I'm in the health club business and, we got a few things that are 60 grand, like a cryo machine, but,
Hmm.
a treadmill's 6 grand, not 60.
Right, right. Well, the thing there, it takes up space. That's why you need an allotted facility for this. It's a tube. It's a huge tube with oxygen
Sounds
attached to
incredible. I want one.
it. I'll refer you to that place where I go, so you can definitely
Okay,
check
I'll go
that
try
out.
it. So, one thing that caught my attention that you said, mold toxicity. How does it affect that?
So as I mentioned, the mold kind of gets into the system, like deep into the crevices of our body, where they like to stay in areas where oxygen doesn't go to, meaning because it will kill them. And this is like your sinuses, right? Areas where blood flow is very low, and that's why when you force now oxygen into, so that's the concept of hyperbaric. It's basically a bunch of oxygen being forced into your body forcefully so it can actually increase the distribution of oxygen to different organs. So when mold gets exposed to these oxygen molecules, they now react in a good way to the point that they get destroyed. So that's a basic concept. There's more concept behind that. But for our viewers here, just to understand that mold is just they grow or stay in areas that are hard to reach, and hyperbaric oxygen makes sure that it goes there in terms of therapy.
Well, oxygen is an incredible thing, and athletes are really chasing it.
Yep.
More oxygen to the muscles. And wow, what a great longevity treatment. I mean, if you can get more oxygen throughout your body, if you're over 50, 60, 70, 80, more oxygen to every part of the body
Yes.
is going to impact your health if you're over 50, right?
Yeah, and then that's a good point you brought up. It's being used also for neurological preservation because it's hard to get oxygen to the brain because of the blood-brain barrier by forcing oxygen to go there. Now imagine all of these neurons that gets fed and are happy with oxygen, and now they function better and they do better things. And the good thing about you mentioned about in longevity, there is also what we call stacking. So it's not only applied in the peptide world, you can also do stacking with hyperbaric therapy. For example, a good stack that I like is give a patient IV, for example, like their high dose vitamin C. In order for that vitamin C to be distributed properly, you put that patient after getting the IV into a hyperbaric chamber. Now you're really going to push it deep in there and you're going to distribute that the best way that you can. Peptides, even before I tell patients if you're going to jump into hyperbaric oxygen, inject your peptides first so that those peptides can be distributed properly. So as you can see, it's a booster of
Yeah.
any, right? Even supplements, anything that you like to do. Like I like my peptides that are the mitochondrial stimulants, like the SS31, opithalins, the longevity, and
Motzi.
right, MOTS-C. Those are the ones that I always say before you get in there, inject that peptide, and then you go and get the maximum benefits from it.
It seems like it would magnify everything.
That's right. That's why it's a win-win. You can't lose from this.
Yeah, I can see how athletes and older people now, I'm assuming you can't just go do it once and think it's going to change your life.
Yeah. Hmm.
How much do you have to do this? Do you have to see results? How many times a week? For how long? Give us an idea on that. If
Right.
someone really wants to see results or see a difference from this, what do they have to do?
Right. So according to the study that I mentioned a while ago, 40 sessions was when the children with autism noticed the changes in terms of improvement in the subjects. So that's just basically a long process. What I do with my patients in actuality, because I have more of longevity integrated patients who's focused on anti-aging, I tell them get a set of 5 or 10. Those are good ways to start, and then you could do what 1 to 2 or even the most 3 in a week, and that definitely would be a good start because, as I mentioned to you, these patients that I have are stacking. They're not only doing hyperbaric therapies, they're doing the IV therapies, the peptides, and in those in betweens, there are other modalities that are at play, and that's why this is really I like this for maintenance. I like this for general health, but 1 to 3 per week is actually a good way to go. And then maybe doing 5 possibly in as a package or even as a 10 or a 10 package will be fine. Depends on the facility that you're going to be going
Right.
into.
Okay. So you get 10 and you do 2 a week. 5 weeks, saying you should notice something.
Yeah, I mean, I've done let's say a week. A good example for you, I had dental surgery, and I did 3 in a row hyperbaric oxygen therapy. The inflammation that was expected post-op didn't happen. So that's why it depends on what you're trying to achieve with the hyperbaric therapy. So that's why I'm a big fan of this. I'm an advocate. I hope everybody could do this. Sometimes the finances would be the struggles, but if it's going to be available for you, I wouldn't say no for somebody to go through a hyperbaric oxygen therapy.
All right. Well, Doc, any last thoughts?
Yeah, so this is actually, people are kind of like, I have a lot of questions about safety. This is a very safe procedure, especially when you're talking about soft chambers. And the most common complaints, ear pressure, sinus, claustrophobia, if you're not used to staying in the tube. But again, these are things that are very manageable. And something that this is very promising. It's still evolving. So as physicians, we should remain both enthusiastic and maybe scientifically humble about these new technologies that we see. And again, if let's say a hyperbaric is something that you could do every day, would you live to 120? Maybe, but still, it's not going to replace eating vegetables, exercising, sleeping well, right? Managing stress. And then adding a little extra oxygen there would certainly give yourself a much better chance than arguing with strangers on the internet about longevity.
Yeah. Eat your vegetables.
Yeah.
All right.
Great lesson.
Dr. Nario, as always, thanks for being with us.
Well, thank you, Steve, for having me again. As we all know, that knowledge is power. And thank you for letting me provide you with a edge on longevity and health maintenance, which I call the biological edge or the bio edge.